Good morning again, everyone. It's my pleasure to officially welcome you to the March meeting of the Long-Term Care Planning Committee. I know it's a super busy day for folks in the health and human service space, so I appreciate your time here this morning. I'm going to just remind everyone the meeting is being recorded. So when you speak, if you could please just give your name, that would be incredibly helpful. And if you could stay muted so that we have a clean recording, I would appreciate that as well. And with that, I'm going to jump right in with roll call. So I am here. I'm Melissa Morton with the Office of Policy and Management. And Christine Weston.
Hi, good morning. Christine Weston, Director of Community Options at the Department of Social Services.
And William Seals. Okay. Margie Gerundo-Marquette.
Morning here.
Hello. Good morning, Margie. Kelly Kendall. Krista Ostaszewski. Erin Levitt-Smith is back with us again.
Yes, I am. I'm here.
Barbara Cass.
Good morning, Melissa.
Good morning. Jessica Rival. Matthew Tazinski.
Hi, everyone. My name is Matt. I don't think I've met everyone here, but I am a transit planner at the DOT.
Yes, welcome, Matt. So Matt is a new member. He is taken over as the DOT appointee to the committee, and we're very happy to have him. He's been very active on our two work groups, so we know he's going to be a great addition to our team. Michael Centuro.
Present.
Fantastic. And Representative Garibay. Here because I see her. Representative Belinsky.
Representative Mitch Belinsky, 106th District, ranking member of the Aging Committee. Thank you for having me.
And I see that William Seals has joined.
Yes,
William. Okay, great. Thank you. Has any other committee member joined whose name I did not call?
Me, Melissa. Call me Marie.
Oh, you're just a member of the public on this one, Marie.
Oh, good. Yay. Oh, yay.
But happy to have.
Oh, yay.
No,
It's on my calendar. I just joined. I don't know.
no assignments for you.
Yeah, but we love having Marie present. So, and we'll be calling on you, I'm sure, Marie. So thank you for being here. I also would like to take a moment to announce Yao, who is our Yale graduate fellow. You'll be hearing from her later in the meeting, but she is going to be helping to assist the committee on a project. Yao, would you like to just say good morning?
Hi, everybody. I'll be very glad to speaking to you today about my capstone project later in the meeting. It's very nice to meet you all. Good morning.
Thank you. And Representative Belinsky or Garibay, would either one of you like to make an opening remark before I kick us off?
All right. It doesn't look like Rep Garabay's got an active connection. So, Jane, are you there? All right. Well, I'll be very brief. Thank you for all of the work you do as your legislative partners run from emergency to emergency. You guys are always here doing the work, and we really appreciate it. So thank you very much.
Thank you, Representative. And I'll see Representative Garibay, it looks like you might be having better connection now. Would you like to say anything before we start the agenda? For some reason you have no sound. Oh, I'm so sorry. If you want to try to leave and come back, that might resolve it. I wish I can't unmute you, unfortunately. All right. Thank you. She says, welcome everyone. So let's get right into the agenda. First, I would like to entertain a motion. Everyone should have received the minutes. They were sent out soon after our December meeting. Hoping everyone had a chance to look at them. I would like to entertain a motion to accept the minutes from the December, I think it was 9th, December 9th meeting.
So moved.
Thank you, Michael
second.
Santoro. And Aaron seconds. Is there any discussion, any revision? Okay, hearing none. All in favor of adopting the minutes from December 9th, 2025, say aye.
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 Thank you. Any opposed? And any abstentions? Okay, great. Minutes pass. We'll get right into our next agenda item with our updates and announcements. I would like to, at this point, we're going to start off with very brief subcommittee updates or working group updates. I will start by introducing Karen DeNorfio, who is chair of the Long-Term Services and Supports Plan Implementation and Progress Tracking work group. And she's going to let us know how that group is doing. Karen.
Good morning, everyone. Thank you so much for having me. Karen DeNorfio, the Director of Operations for Harvest Healthcare Behavioral Health Group in long-term care. And today I am representing as chair the LTSS Plan Implementation and Progress Tracking Work Group. So I have a very, very brief update for all of you today, as I heard you have a very busy day. Our work group did meet twice since our last report. We really completed a very in-depth and thorough review and discussion of the current plan. We identified areas that we thought were important, kind of grouped them into some themes that we felt were important throughout the plan. And we'll be looking at all of those areas and themes, determining some speakers and ways to reevaluate based on not sort of redoing work that's already being evaluated, but finding other ways to evaluate how that work is being done. And we definitely plan to move forward with this important work in the coming months after we see what bills have passed. Thank you very much, everyone. If anyone has any questions. Great.
Great. Thanks so much, Karen, and thanks for the good work of all the work group members. And with that, I'll turn it over to Deb McNaught, who is co-chair of the Long-Term Services and Supports Plan Development Work Group. Deb.
Hey everyone, Deb McNaught from the UConn Center on Aging, and I'm here today representing the work group for long-term services and supports planning, setting the goals and objectives for the next long-term care, long-term services and supports plan. We have met, I believe, 2 times since the last long-term care planning committee meeting. And we are starting to engage in what's called a SOAR planning process. SOAR stands for Strengths, Opportunities, Aspirations, and Results. We will start that by doing some work individually by putting our own thoughts down on paper, our strengths, opportunities, aspirations, and results through sort of a facilitated online tracking of those things. And then we are going to be meeting in person for a half-day planning session at the beginning of May or middle of May after the session ends. We are also engaging in a looking over the current goals and recommendations, and everyone putting forth their what they believe to be the most important things and things that maybe are no longer as important, and a sort of hierarchy, but individually. And then we'll bring it all together collectively to have that robust discussion in May. So we also, I just wanted to also state that we, Yao introduced herself earlier, but we also have Yao that's helping us with some pieces of this, and she's going to talk a little bit more about her work in a little bit, but that will also add to our work in this work group. So we're thankful to have her involved. I think that's pretty much it. Thank you.
Great. Thanks so much, Deb. And you gave a beautiful segue to Yao. Does anyone have questions for Deb before I transition? Yao is going to give us a brief update on what the research that she is working on as part of her capstone project at Yale, and that will also be informing the work of this committee and one of our long-term care plan goals. And so I'm excited to turn it over to her. Once Yao provides her presentation, we will then be going to our annual update that we do of legislative session updates. We engage in this every March. And so agencies, be thinking if you have any bills that you would like to flag for the group as we get into that discussion. So Yao, I turn it over to you to talk to us a little about the work you're doing.
Of course. Melissa, can I go ahead and share my screen?
Please do. Thank you.
See? Is everyone seeing my my screen right now?
Yes.
Yes, okay, thank you. All right. Good morning, everyone, and thank you for allowing me the honor to present my work today to the work group. My name is Yao, and I am a second-year health policy student at the Yale School of Public Health. I'm currently completing an internship with the OPM, specifically working on a capstone research project. The purpose of today's presentation is to briefly introduce my capstone project and the research plan behind it. Since the project is still in progress, the goal is mainly to give the work group visibility into the research and invite feedback as it develops. I'll start with the policy context that motivated the research, then introduce the research question and the policy models I plan to examine. The motivation for this research comes from the growing fiscal pressure on Connecticut's long-term care system, particularly on Medicaid. Medicaid spending on long-term services and supports has increased significantly over the past 2 decades, from about $1.9 billion in 2003 to nearly $4 billion in 2024, an increase of roughly 107%. Looking ahead, projections suggest that if the current trends continue, Medicaid LTSS spending could reach about $7.7 billion by 2028 as demand for long-term care continues to grow. To understand why financing report is becoming an unavoidable policy question for LTSS in Connecticut, it's important to look at the demographic trends driving future demand for long-term care. Connecticut's population is aging rapidly. Between 2022 and 2028, the population aged 65 and older is expected to grow by about 16%, and the share of older adults in the total population will increase from 19% to 21%. Because roughly 70% of adults over age 65 would need some form of long-term services and support during their lifetime, population aging alone is projected to increase LTSS demand by about 10 to 11%. At the same time, people are not only living longer, but longer life expectancy also means a higher burden of disability. The number of Connecticut residents living with a disability is projected to increase from about 446,000 in 2022 to over 481,000 by 2028. Among adults aged 65 and older, the number living with disabilities is expected to increase by about 21%. This growth in disability among older adults means that demand for long-term care will increase not only in scale, meaning more people needing services, but also in intensity, meaning many individuals will require more complex and sustained care. Against the backdrop, Connecticut's LTSS financing structure remains heavily reliant on Medicaid. In state fiscal year 2025, Medicaid LTSS spending totaled about $4.32 billion, which represents roughly 39% of all Medicaid spending. The state has set a goal of increasing the share of LTSS costs covered by private and other non-Medicaid sources to 25% by 2028. However, national benchmarks suggest that private sources currently account for closer to 22%. As mentioned in the beginning of the presentation, if the current financing structure remains unchanged, Medicaid spending on long-term care is projected to reach about $7.7 billion by 2028, which could place significant pressure on the state budget. A closer examination on Connecticut's LTSS financing structure shows one major limitation, which is the limited Sorry? A closer examination on Connecticut's LTS financing structure shows one major limitation, which is the limited involvement of private long-term care insurance in Connecticut's long-term care payer structure. As of 2023, about 97,000 Connecticut residents held a private LTC insurance policy, which represents roughly 15% coverage among residents aged 60 and older. Although the state created the Connecticut Partnership for Long-Term Care to encourage enrollment, participation remains relatively low. The market has also faced instability. Between 2019 to 2024, more than 17,000 policyholders experienced premium increase of 50% or more, and only around 1,200 new policies were purchased statewide in 2023. Today, only 2 insurers remain active in the Connecticut Partnership Program, which further limits consumer options. Therefore, finding policy models to revitalize the private LTSS insurance market will be a core focal point of this research. Given this context, the main research question guiding my capstone project is, what non-Medicaid financing models could help diversify LTSS funding in Connecticut and reduce long-term fiscal pressure on the Medicaid program? To explore this question, I'll look at how other states have approached LTSS financing reforms and which elements of those models might potentially be adaptable to Connecticut. To explore that question, the project will review several different policy models that have been implemented or explored elsewhere. These include Washington State's Washington Cares social insurance model, Minnesota's Own Your Future initiative, California's statewide LTSS financing initiative, and community-based approaches such as the Village model. I will also review historical federal legislative proposals and other research on LTSS financing reforms. For the capstone project, my next steps are, first, I will conduct a policy landscape analysis of Connecticut's current LTSS financing system. Second, I will conduct a comparative review of alternative financing models used in other states or proposed on a federal level. Third, I will assess the potential transferability of selected models to Connecticut's policy and fiscal environment. Finally, the project will produce a capstone report summarizing the findings and highlighting potential policy insights. That concludes my presentation. I want to thank you all for being here today, and most importantly, as I continue developing the research, I would greatly welcome any feedback from this group, especially if there are any specific models, policy initiatives, or research areas that you think would be valuable to include. Thank you again for your time, and I'm happy to answer any questions or hear your suggestions.
Thanks so much, Yao. I really appreciate your good work. And as Yao said, we welcome from this committee any suggestions you might have if there are other non-Medicaid sources of long-term services and supports funding, or models that other states are doing, or things that maybe your agency is already looking into or pursuing that she can include in her study. That would be wonderful. Anything you could do to support Yao, and then that information from her capstone project is also going to help inform one of the long-standing goals of the long-term care plan, which has been to look at also trying to rebalance the funding streams for the long-term services and support system, and reduce the heavy reliance on Medicaid, and encouraging people to plan ahead for cost, etc. So thanks so much, Yao.
Of
Appreciate it.
course.
Okay, any questions for Yao before we move on? And we will distribute the presentation with her email after, and you can reach out. Yes, Representative Belinsky.
Yeah, thank you for the presentation. It was very enlightening and very frightening at the same time. I don't have an answer, but I think we need to be a little bit more aggressive as a state and as a legislature in trying to figure out ways to reform the way private insurance works, and stop having everything fall to the taxpayer, and default to Medicaid. It's frightening to see the amount of resources that are not being, in my opinion, fairly shared. So on that note, just a comment.
Thank you, Representative. I think that speaks to why Yao's doing this important work and studying this issue. States across the nation are grappling with how to fund long-term services and supports as there's a rapidly aging U.S. population. So thank you for that. So at this time, I am going to turn it over to we're going to hop down to our next agenda item, which are our legislative updates. I am going to actually hold mine a bit because I know some of my colleagues have to head over to Human Services. So I would like to kick it off by turning over to DSS to see if Christine, does DSS have any legislative updates?
Sure. Hi. Good morning, everyone. Christine Weston again, Director of Community Options at the Department of Social Services. As many of you know, there are some high-profile bills that are going through right now. Lots of testimony on them. I'll touch on two brief ones that are around nursing homes and then get into the larger ones. So we do have PDPM at the nursing home, which is patient-driven payment models, and an act concerning the funding of the quality metrics for that program has come up for nursing homes. We're in a great support of this, as it really will be driving and aligning our methodology with a federally mandated system that focuses on the residents' clinical characteristics and their nursing needs and their care needs, rather than our previous model of funding the building. So looking forward to that one. That's done in a sister unit over here at DSS, but very important for kind of how we look at all of the long-term care needs of individuals, because as though I focus on HCBS, there is still a critical need for institutional services and nursing homes, and we want to make sure that we're properly funding those buildings and providing quality care in those buildings. Another one is on the moratorium for the nursing home beds. We've had a tremendous commitment in Connecticut on rebalancing and right sizing and making sure that we don't overbed our nursing homes so that people can have the choice in community and have access to HCBS in the community. And we're in support of that. But we also acknowledge that there are some deserts of support, and where people do need institutional level of care, they may not have access to the care that they need. So we would like some flexibility in when we can bring beds online, and have exceptions to the moratorium, especially as we see significant closures in some of our communities of nursing homes. We're leaving those individuals in that community without an option, and that's not appropriate either, right? So we have to not only right size, but we also have to be kind of fair in how we have access and where someone's community is, and not have someone have to move miles away from their home and their neighborhoods. So those are two that are being tracked in this session and through my partners here at the Department of Social Services. And then the big one, which I know a lot of people will have a lot of questions on. I unfortunately do have to get over to Human Services Committee. So if there are significant questions on the Community First Choice transition, I think Melissa has offered to field some of them, and we can take anything back if we don't have answers for you in that space. But as this advocate community and as all of our sister agencies have probably heard, there has been in the governor's budget a recommendation to transition the self-directed PCA services from one authority into a different federal authority. So it really is moving the CFC services, which are self-directed PCAs, and transitioning those individuals that are actively on services into another program. So there has been a lot of advocacy work about this. Melissa and I have been meeting with stakeholders and other individuals. We have 2 more meetings this week on this topic as well. We have the CFC Council meeting. We're also holding a stakeholder engagement meeting on Friday to kind of go over the myths and facts of what's being shared, and really wanting to resonate the importance of this transition, how it will help the greater HCBS space, how we need to look at a more strategic and mindful approach to how people access services and what services they get access to. So looking forward to hearing from everyone and getting some of our thoughts and ideas out about this transition in the larger groups. So that's kind of the heavy hitters for DSS at this point that I think is most relevant to this group. I can stay on for 5 more minutes. I'll give you 5 more minutes and then I have to get over, but I want to give people space and time to ask questions, and Melissa and I can field those if you have any.
Thanks, Christine. Any questions for DSS? Wow, Christine, go.
Thank you. I am gonna go. Thank you. Take care, everyone.
All right, have a good day, Christine. Thanks for joining. Any other agencies have updates they would like to share or bills they would like to flag? And Mairead, you're welcome to jump in on this one as well. I know you're heavily involved in this space if there's anything you want the group to be aware of.
I think one of our major ones that we're promoting for residents is the increase to the residents' personal needs allowance. That's the one that I think they have us tracking most carefully for them at this point.
Do you have a number? I don't remember off the top of my head the number for that one. You can put it in the chat. Thank you.
Yep.
Anybody else? Okay, great. Anybody else have any bills they'd like to flag? I have a couple, but Yes, Krista.
Thank you, Melissa. I can talk very briefly about the 2 DDS bills and then about another bill that we are tracking that may be of interest to the committee, just very briefly, if that's okay.
Yes, please.
Great. Hi, everyone. My name is Krista Ostaszewski. I'm the health administrator for the Department of Developmental Services. First, I apologize. I was a few minutes late this morning, so I was not on early to do a quick introduction. I just wanted to mention very briefly, DDS has 2 bills that they're working with the Public Health Committee to pass this year. One is a technical bill, 5240. And that is really just a technical revisions bill making some edits to our statutes. And then the second bill is 5239, which is a bill that makes some changes to the makeup of the Mortality Review Board and Fatality Review Board for DDS. Both bills did just recently pass Human Services last week, so we're very excited about that. But the one bill I did want to mention that I thought might be of interest to the committee is actually 5485, which is an act concerning supportive decision making. An act supporting supportive decision making is actually a bill that provides some alternatives to guardianship for individuals with intellectual disability. So we do have some advocates and some stakeholders that are very interested in this bill. The department is watching very closely, taking a look at what that means in terms of the context of probate court and in terms of decision making for individuals with intellectual disability. So I wanted to just make sure to flag that. Again, the number for that bill is 5485. That's it for me, Melissa. Thank you.
Great. Thank you. And I see that Representative Garabay, you have your hand up?
Is it okay if I comment on the aging bills?
Please do.
So we're very excited that 21, 22 bills, and some of you know our bills better than I do even, have been very involved. We're very excited that all were JF'd out of committee, which is really good. The House bills went on consent calendar, bipartisan support, unanimous. All our bills went out. So we're looking forward to a really exciting session, and some like the tech aid, et cetera, that we thought we would have difficulty with everybody working together. They've all pulled together. And I'm not going to bore you with all the details because you can go on and see and whatever, but we're just really excited, and thank you for all your support to all the agencies, et cetera. Marie Painter, it goes without saying, working together. So thank you, everyone.
Thank you, Representative. Marie?
Hi, sorry, now that I have it pulled up, there's just a couple of things I did want to touch on. One is, focus on transparency. That is another bill that we're looking at every year. We kind of take another bite out of that apple to make sure that we have an appropriate amount of information. Kind of towards this, the funding of the quality metrics program for nursing homes. We really want to see that nursing homes that are doing well, providing high quality care, that's supported, and that they have maybe a little increase there of what that looks like for them. Training and assisted livings for the supports in there and having them educated, but also for our fear of retaliation, that not only be required in nursing homes, but also in assisted living communities. I put the bill in the chat for the resident council piece. I'm just looking quickly here. Fear of retaliation and the technology use, that individuals will be able to use the technology if they're choosing, also in residential care homes. And then the final one that I think is really important is having the hearings, public hearings for rate increases that we're seeing related to assisted living. So thank you. And thank you to our representatives that have worked so hard on the aging committee to get so many of these bills out there to be discussed.
Great, thank you. And appreciate all the good work everyone's doing out there. There are a couple I want to flag from the OPM shop just to make sure that folks have them on their radar. First, one very important to the work of this committee is SB 433 coming out of Human Services. That is regarding, I believe it's called an act expanding Medicaid. Let's see here. And that one is, again, asking that this committee do a study that is duplicative, actually, of all the data points that are in our current long-term care plan and rebalancing report. So we are working on that, but please look at SB 433. It asks to look at things like trending, number served in the community versus an institution, cost savings associated with serving people in the community, all the things that we study as part of the long-term care plan and the annual rebalancing report. So hoping we can do some education around what already exists and all the good data that this group already is collecting and has available to the public. And then I also want to flag SB 87, which is an exciting one. It is to support our nonprofits. And let me just pull up. I'm sorry, I have too many screens open without all of my notes here. So an SB 87 is an act strengthening nonprofits. And this is a governor's proposal, and he's proposing to establish a new nonprofit advisory board that would be supported by a new nonprofit policy coordinator that would be housed out of OPM and actually our Health and Human Services division. And the board is designed to improve communication and coordination between nonprofit providers and the executive branch, so that really nonprofits in the executive branch can combine efforts to streamline efficiencies, align policy efforts, and engage in better communication and better systems delivery. Nick Turcotte out of my office has been the lead on this. Nick, is there anything you want to say on SB 87?
Sure. Thank you, Melissa. And good morning, everyone. My name is Nick Turcotte. I'm a research analyst in the Health and Human Services Division. So in addition to the Nonprofit Advisory Board that's part of SB 87, the bill itself also seeks to support nonprofits in the provision of their services in the state by protecting volunteer drivers from auto insurance rate increases or denials solely due to the fact that they drive on a volunteer basis, which is really essential for our senior communities and community of individuals with disabilities in the state. And the bill also includes a provision to limit the duration after which a claim was submitted to an insurance carrier, by which the carrier can retroactively deny or cancel payments for those claims. So right now, managed care organizations can claw back payments for claims up to 18 months. This bill shortens that to 12 months and expands this period to all health insurers. So really great bill and really promising for improving communications between the executive branch and nonprofits over the long term and helping respond to changes that come out of the state or federal level and promote effective policy for improving the delivery of services by nonprofits. So if you have any questions or if you want to set up time to discuss the bill further, please feel free to reach out. My email address is nicholas.turcotte@ct.gov, and I'd be happy to touch base with you. Thanks so much.
Thank you, Nick. Yes, Representative Belinsky.
I want to say thank you for raising the awareness of that bill. You know, sometimes we get a little bit buried in our own little worlds. In our committees, we don't necessarily know what other committees are proposing. This is a really important bill, because we come down to starving our nonprofits on a annual basis, and it's time for that to end, not just from a funding perspective, but also from an understanding perspective, and to have a better direct link between the executive branch, the legislative branch, and the nonprofits, so that not everything is treated like an emergency. So thank you, Nick. Thank you. For everybody, just because you've got a great bill that's out there just does not necessarily mean that that any one of us individuals has an awareness of it, because we're sort of all wrapped up in our own worlds from time to time. So thank you.
Thank you, Representative. And I also, to that end, want to flag one of the bills that the Aging Committee worked on that we want folks to be aware of. That is one of the many good bills that important committee has done, and that is HB 5143, an act requiring training for homemaker companion agency employees. We hear often about that some of our unlicensed workers have varying degrees of training and quality assurance, and the Aging Committee put forward a bill that seeks to address that by requiring certain minimum training requirements And I think some of that came out of the legislatively mandated study on the best practices in training for homemaker companion agencies that was done a couple years ago and submitted to the legislature in 2024. So really appreciate that good work. And that is a bill that look forward to tracking as well. I don't know if either one of you want to remark on the homemaker companion training bill.
I'll just chime in that you're exactly right, Melissa. And it's been for several years. Another large, big impetus was the Alzheimer's Association and their push for the Alzheimer's piece. And I think we all took advantage when thinking about it. How could we make, like you said, make it regulated, complete, et cetera. So thank you for that support and all of you.
Excellent. Thank you. And then I will just, in closing, touch upon the governor's recommendation to transition CFC from a 1915K state plan authority to a 1915C waiver or other Medicaid authority. And really the key talking points that I want to make sure people understand about this transition, and perhaps all of you as our sister agencies and allies can help to get some accurate information out in the community as you talk to folks, is that the real focus of this transition, as you know, our long-term care plan for years has been focused on rebalancing the system as it relates to the number of individuals served in the community versus a nursing home. And we set our goal to do that, to have 75% of individuals served in the community versus an institution. And the state has moved and been able to get about as close as we think we're going to get to that. We teeter between 70 and 71% now of individuals being served in the community. So we're doing, we did a great job, and that is an effort that the state is remaining committed to. However, now as we take a step back and looking at Yao's research and some of the research that this committee has done to support the long-term care plan, what we're finding is we also need to focus on really rebalancing our home and community-based services system. If that's where most people are being served, we need to look at access and equity within that system. So how do we maintain our commitment to rebalancing, making sure that home and community remains a true choice for individuals, but also making sure that that choice isn't just self-direction or get on a waiting list that has a years-long waiting list. So how do we really look at taking our Medicaid dollars, looking at the home and community-based services system holistically across the program array, right? So look at our waivers and our wait lists. Look at other non-Medicaid programs, other potential authorities that we may have to serve individuals. And instead of just focusing on one sector of our community receiving home community-based services, look at addressing the holistic home and community-based service community and using our dollars in a manner that allows people true choice. They can continue to self-direct, or they may continue to utilize an agency. And to that end, how do we continue to support our agency-based providers so that they have the capacity with which to take on additional clients? So growing the whole sector, and that is really important to the governor. It's important to us that people have a true choice. And so we remain committed that those who are currently on Community First Choice will transition to a new service authority, and their services and supports will not be reduced due to the transition, right? So that people undergo annual assessments and all of that, but their services will not be reduced due to the transition. Additionally, the state is committed to rebalancing the system and maintaining that rebalancing. So we are looking at how can we best use our Medicaid dollars to make critical reinvestments in the system. So take some of the savings that we might have from CFC, and actually in the first year there isn't savings, but in out years, how do we reinvest those dollars across our home and community-based system to address our waiver wait lists and to ensure that people across the system, that it's not, oh, you get on a waiver and you're on the waiver for 5 years or 7 years, that there's an opportunity to move. So committing to doing real, true study and modeling of how we can best reinvest our dollars to ensure that people have access across the broad array of home and community-based services. So I just wanted to get that statement out there in case folks are hearing some getting some feedback from the populations that you all work with and from your provider agencies. And we developed a frequently asked questions document that is done and going to be posted on the publicly very shortly, like I'm hoping this week. And there will also be a mechanism through that. We will be updating the frequently asked questions regularly, DSS and DDS. As we receive questions from the community, from legislators, there will be a mechanism for people to submit their questions. And the FAQ will be a living document that will be continually updated to try and get some good information out there so people can make whatever decision they want or have an opinion, but that opinion be based a fact-based opinion. And additionally, as Christine alluded, we are doing quite a bit of stakeholdering. We are going to meet with stakeholders, being providers, users of CFC, advocates. The first stakeholder meeting will be this Friday. We plan to hold more. It is very important to us that the reinvestment of dollars moving forward actually addresses the needs and incorporates the feedback that we hear from the community and the users of the system. There is a true commitment to that, and we look forward to taking the next 17 plus months to working with our partners and the people that utilize the system to gather feedback and be able to come up with ways that we can reinvest in an accessible, sustainable system that continues to meet the needs of Connecticut residents, both on the program now and those that might be needing our services in the future. So thank you for indulging me in my spiel. Is there anything else that anybody would like to say or other legislative updates? Is there any other business that anyone would like to bring before the committee today? Yes, Deb. Oh, I think you're muted, Deb.
Okay, sorry. Thank you for indulging me and letting me I wanted to just give a quick update on Core Q. It's related to the both, I think Mairead mentioned it, and Christine about the nursing home quality rate setting. And I just wanted to mention that UConn Center on Aging has been doing Core Q satisfaction surveys with Connecticut nursing homes, all Medicaid nursing homes in the state of Connecticut. For now, we've just released the 2025 results. So I'm going to drop the link in there in the chat for the 2025 results of the Core Q. Core Q will be incorporated, or if the quality-based rate setting goes forward, Core Q would be the nursing facility satisfaction piece of the quality metrics. But even though the quality program has not moved forward as far as rate setting, we still are engaging in doing these Core Q surveys throughout the state of Connecticut. Again, I think we're the only state that is going to every single nursing facility in the state. We go in person, we interview residents in the nursing homes. We do also follow up. We also do survey interviews with family members via both email and phone call. And so every single nursing facility that receives Medicaid funding in the state does get surveyed. So we have 2024 results, we have 2025 results, and we are in the middle of, it started collecting 2026. So I will drop the link in the chat so you can see the results there. But so I just wanted to mention that because it is related to the quality rate setting. And I know there's interested parties on the call. Thank you.
Thanks so much, Deb. That's really, important work, and I'm glad that you brought that forward. I think it's important for everybody to know what Connecticut is doing. Anybody else have any other business? Okay. Thank you, Deb. Deb just put the link in the chat. So with that, I am now going to open it up to public comment. Is there any public comment? Okay, seeing none, I will entertain a motion to adjourn.
I'll make a motion to adjourn.
Thank you. Motion made by Matt. Is there a second? And Aaron with the second. All those in favor?
Aye.
Aye.
Great. Thanks, everybody. Have a great spring, and I will see you all again on June 9th. Thank you. Have a great day.
Melissa,
Yes.
you run the most efficient and well-balanced meetings of anybody. I nominate that you do all of the meetings for everybody from now on.
Well, this is a particularly good group, so I can't take all the credit. Thank you, though. Have a good day, everybody.
Have a good day.